everyone, Kim Castellano from Conversations That Inspire, your host. Today's show is about understanding the culture and mental health awareness. As you know, we are at the stress coaching, we're at the foreground and really helping people to understand mental health and directing them to resources. So today we have a panel of guests that are full of resources for the community, and I'm really happy to announce them. So we're going to go around and just introduce each one to you and a little bit about where they're from and the services that they offer. And our first guest is me.
Hi everyone, my name is Rebecca Quinn, and I am the service liaison with Serv's Outpatient Behavioral Health Clinic in Clifton, New Jersey. We are a fully outpatient clinic that offers treatment in mental health and in substance use. We accept all insurances pretty much, including Medicaid and Medicare. We even offer services to individuals that are uninsured.
Wonderful.
On to you, Beth.
Hi everybody, my name is Beth Halprin. I'm a psychiatric mental health nurse practitioner. I work for Caring People, which is a home health agency, as well as a mental health and behavioral health division that provides psychotherapy and care management services throughout New Jersey, as well as 5 other states.
Wonderful.
Hi Kim, thanks for having me. My name is Ruth Kaluski. I'm with the Mental Health Association in New Jersey. I wear a bunch of different hats, but the Mental Health Association really focuses on advocacy, education, mental health awareness, and we've been doing a lot of disaster mental health around the pandemic. So happy to be here. Thanks.
Yes, wonderful.
Awesome, thank you. Thank you for having me. This is my first time being on a show like this. So
It's okay. We're doing good.
it's very exciting. It's wonderful to meet everyone. My name is Gada Saleh, and I'm a licensed professional clinician. I work at the Mental Health Association, but in Passaic County, so
Yes.
very similar partners here. We offer services to families, to individuals, children, adults. We offer education, peer support, counseling, psychotherapy, and we have a really large population of Hispanic and Arab American.
Right, so you kind of understand the culture. So your role there is?
I'm the outpatient program director, and I spearhead our Arab American initiatives.
Yes.
I'm also an Arab American myself, and I speak Arabic.
That's wonderful. So thank you. So we have a lot of different people on our show today, and our other guest.
Hi, my name is Jeanne. I have interned with Kim at Power of One, which we didn't really talk about yet.
No.
But do you want to talk
Your
about
role
it?
now, where you
Sure.
serving?
Okay, so just go right into
Yeah.
that.
Where are
Oh,
you
got
serving?
you. Okay. So currently, I am a clinical assistant in Damon House in New Brunswick, New Jersey. It is a it's both inpatient and outpatient facilities. So there's an inpatient in New Brunswick, New Jersey, and an outpatient in New Brunswick, and also in Paterson, New Jersey. So Damon House offers just comprehensive services, very similar to what you were discussing, but inpatient. So Medicaid, Medicare, no insurance, indigent. Some people come from, actually it's all men, come from straight from prisons, New Jersey state prisons, jail, other institutions. Some are on the program drug court, and then others are volunteer. Mm-hmm. And yeah, they essentially serve everybody. And again, it's a comprehensive approach, so it's medical, it's clinical. So there are 2 psychiatrists that meet with clients and can prescribe meds as any psychotherapy meds as necessary, and then there is a whole clinical staff, a wide array of different people.
Wonderful. So, Beth, you serve the senior population.
Yes, we primarily provide services to the senior population. Our particular division provides services for most of the panels, people that are on Medicare, Medicaid, the HMO, the Advantages,
Right.
the Advantage programs.
So mental illness, can anyone explain to me, like really mental illness is what we're talking about, but their culture is there, but let's just get a grip of what is mental health? Someone's watching right now and like, how do you even describe what that is?
So I like how you said that. What is mental health, right? So instead of mental health, everybody has something around mental health, right? So mental illness is something that not many of us are qualified to diagnose. So I'll put it out there in a way that everybody can understand. Really, it's a mental health challenge, something that affects somebody's emotions, their thoughts, their feelings, their behaviors. It can be physiological, it can be biological, right? So we want to keep that in mind. But we really want to think about folks in terms of how we think about physical illnesses. It's something that we work on. Recovery is possible. It's something that people can get better from. And most people who experience mental health challenges, which is kind of how I like to talk about it, at the Mental Health Association, we talk about mental health challenges. How can we help somebody really recover and do well? And so that's
So the
really
word challenge,
Yeah.
instead of saying you're mentally ill, it's mentally challenged. Is that the new language that we hear a lot of, or?
Well, I think if we're not diagnosticians,
Right.
that's what we would call. Somebody is experiencing a mental health challenge. If somebody decides to share what their diagnosis is, that's different. But we need to be really careful when we meet people. And this isn't just about our work. This is our friends, our family, our community, people in the room. We need to be really careful not to label people because we know that can create barriers to care.
Right.
So somebody might have a bad day or somebody might be experiencing something a little bit more serious.
Right.
Same thing around substance use. Right, so you've seen the new language, and I heard Rebecca say it, and I loved it. Substance use disorder, people who are experiencing substance use. We're not talking in the same way, the same language that
Right,
we
it's
used
not
to.
harsh.
It's not. Well, it's not judgmental, and it's not
Yeah.
diagnosis. How can we diagnose? And even some of us who are licensed to, we don't do that to our friends, our family, our community,
So
our
you're just going
coworkers.
through a medical challenge right now, a mental
health challenge. Yeah, I
Mental
love that you
health
said that,
challenge.
though.
And I
What's
think-
mental health?
Yes,
Yeah,
and I think wording it like that, it helps to really push that everyone has mental health. Anybody can experience mental health challenges, regardless of age, background, cultural backgrounds, location, anything.
And I
This
think
applies to everyone.
Yeah, and I think that's something that's really important is that it's very easy. People think about when they have trouble with their liver or they have problems with their sugar. The brain is an organ just like every other organ, and sometimes it's not working to the capacity it could be working at. So sometimes you need different modalities to help you get to a point, and we know that the brain can change. So, sometimes getting somebody to talk to will help with those challenges. Sometimes people need to be on medication, just the same as if you had diabetes.
Right. Correct.
And
Go ahead.
No, sorry. And I was going to add that I think something that we always like to point out is that the mental health challenges that affect our mood and affect our behavior can be commonplace for everyone. And really, when we're talking about diagnosis, so even as someone who does diagnose, there's criteria. And so when we talk about mental health challenges, we can talk about things like a depressed mood or anxiety, which are commonplace if you're having marital conflicts or challenges, at work, or you're moving, or there's big changes. These are all normal feelings and emotions that we might experience. And when we're talking more about diagnosis, which there is no harm in diagnosis because it can help us lead to the correct avenues and the correct treatment, we're talking about things that are more persistent, more acute. And there are criteria for diagnosis, time frames, and things that might affect now your daily living. So now you're not able to function at work, you're not able to function at school, you're having relationship difficulties, and this is when we talk about diagnosis. But they're commonplace
grief
feelings.
is grief, and I'm not
Absolutely.
mentally challenged if I have a grief issue. I'm just going through the grief. And some people grow through that process fast and other people don't, but then you don't label me as mentally challenged if I'm really suffering inside. But how has the stigma, and I know that before the pandemic, there were barriers, and I know that, before the pandemic, no one really wanted to talk about mental health, mental illness, and treatment. So we came up with the stigma-free. So how, I remember first aid. I know, Ruth, you can probably tell us a little bit about the mental health first aid, but that's the ground foundation from coming out of the pandemic, because we were doing this work. We just started talking and getting people comfortable. But can you share a little bit about the mental health first aid?
Well, yeah, I mean, I love sharing about mental health first aid. The Mental Health Association, both in Passaic County, our colleagues are also doing that in the Mental Health Association in New Jersey. But I like how you framed the question, because mental health's been around, right? People experience mental illness has been around. And now what the silver lining of our pandemic is that everyone's talking about it. Now it's okay to feel some stress. Now it's okay to feel some anxiety. So we're having these conversations, which is a dream, really. This is something we've wanted for so long. And I think Beth and I were talking before, and maybe you can elaborate a little bit more, about now we're out there and now we're talking and now people are seeking help. But we've got a problem, is that there's not enough help. So maybe you could go into a little bit what we talked about before, and I can talk more about mental health first aid in a minute, but I like what you said, just about how you're looking for interns, how you're looking for social workers.
Yeah, I mean, I think that it's important that people such as myself or the other organizations, we have to be creative in what we're doing so that we can have these resources available to people as they're reaching out. You know, we're talking about mental health, we're normalizing it, you know, it's a part of our lives. So now let's move on, and you know, now that people are reaching out to us, we need to all work together, we need to collaborate. We need to come up with creative ways of getting that help and getting the word out that it's available, that if you're looking for it, we will put something in place to get you those resources, to get that help. You know, there are people that are out there that do care, that are passionate about what we do, and that are there.
The programs, that's what I've been working
Absolutely.
in the senior buildings, and now we having agencies come in with our food distribution and literally connecting them to resources, because they're stuck in their apartments. They don't know what's out there, so we have to bring it to them. So there are populations that are struggling because they don't know who, you know, is doing this service and who can get me the help that I need.
And I just want to add one more thing. I think that it's important for people to know that there are a lot of people out there that are very sensitive to the diversity, the cultural diversities that are out there, and the different ways in that people perceive mental health, how they identify their symptoms, and how they vocalize their symptoms, because some people are very afraid to say that they're nervous, and it might come to a clinician as, I have a stomach ache, or I have headaches, you know, I'm getting migraines. So I think that the education that we all have and being able to identify how different cultures perceive the problems that they're having and being able to identify that symptomology is super, super important.
You want to add something?
We kind of moved on.
Okay. Okay, it's just, I just want everybody to get a little feel for the conversation.
I can touch on that. So on a different referral basis, well, both on an outpatient and inpatient level, we also offer that comprehension, right? So, or not offer, but we can provide that where, you know, we have weekly meetings or bi-weekly meetings with clinical staff and medical staff discussing both aspects of a client's recovery and treatment.
So you come in with creative ways to figure it out. So as a staff, people are starting to think outside the box. One of the things that people have always said about our organization, Power of One, because we are doing a lot of stress. You know, it's easier to say, you know, come to stress coaching, not recovery, you know, not a grief care group. So we know that's a barrier in language for people. They just don't want to, I'll go do arts and crafts, but not realizing that you're doing mindfulness activity. I forgot what I was going to say, which direction it was going with this, but we've, with our stress coaching, anyway, I lost my thought in the process. See that?
Oh, I wanted to say that.
Mental health, right here.
Yeah. What we find challenges in, what I ask clients about all the time now regarding their aftercare plans is they have no idea how to access the mental health once they are discharged.
Right.
They have no clue. And I'm not well versed in it. So just having this conversation now is really educational because they don't, then they're provided meds and they don't have, or they're not sure even how to access those meds. So it's, I think it's
more
great
support
to talk
groups.
about Yeah.
Yeah, and so a lot of what has been said, many things brought me back to thinking about, I'm not sure if anyone here is familiar, but certified community behavioral health clinics. So I'm here on behalf of Serv's Outpatient Clinic, and we are a CCBHC. We have been a CCBHC for a few years. Certified community behavioral health clinics are specialized outpatient behavioral health clinics that are funded through Medicaid and SAMHSA. And the wonderful thing about CCBHCs in the funding, it allows these locations to offer services that are more accessible to the community, to individuals, to populations that may not have had that access before, who have struggled to find the treatment and the supports that they need. The other good thing about CCBHCs is it's looking to help eradicate a lot of these different issues that have already been mentioned. For example, we did speak about how we're trying to, it's about getting the information out there to the individuals that could use the services and bridging those connections, but it's also very much about connecting between ourselves and fellow organizations, because as mentioned, it's not just a diagnosis.
No,
I mean,
I always say it's messy.
Sure.
It really is. When you're helping people, it can get messy because they may have dual addictions. There may be so many things going on. There's barriers.
Stress takes a toll on the body. I mean, it's all connected. So with these initiatives of these CCBHCs coming out and being established across the United States, which, mind you, as of today, Serv was actually one of the first CCBHCs in New Jersey, and now there are about 20 CCBHCs in New Jersey all across, which is great. There's about 450 CCBHCs in 42 states in the US. This is all within the last few years. So just also having people be aware that, listen, we're trying to make these efforts, things are being done, and pushes that we make also with CCBHCs are connecting with all these other organizations like all of your organizations here, so that together we can provide that integrated care for individuals.
Because every person's care is a little different.
Correct.
And every population is very different.
Correct.
Yeah.
Right. I mean, I know that you have the senior population, so they're not out and about. So the services sometimes have to come into them. Or they just looked at them and just say, hey, you're just aging out and that's it. But nobody should. I have a 90-year-old woman who come to our stress coaching groups, and she's just said she forgot that, you're never too old to keep learning. So she says, I'm going to go back to doing what I used to like to do, but she thought that since she hit 90, it was over and she was lonely. So, I mean, I know you can see we have the creativity board there. That's because, you need a creative outlet. And it doesn't matter how old you are, whether you're knitting, crocheting, you need something to help you process through the pain that you have. So the pandemic has really launched us in a different direction. We now know how to think outside the box. We know telemed is very popular now. So it's not like you can say, I don't have a ride to get to the doctor. They'll put you on a telemed. The insurance companies will pay for that service. I'm told it's not the same. It's really not. Not the same as an in-person. So I know that we're doing our support groups and people are coming back into community and they love it. They love the discussions, but they still have their counselors on the Zoom and telemed. But they said they missed that. So we're slowly
Moving back
to whatever normal might look like. But so one of our next leading is here is about breaking barriers and stigmas and taboos, and on the culture. I know some cultures, it's like tough it up, don't cry. There's those comments that were made, and the culture, it's really a barrier for people to getting help. But I want to believe that the pandemic, all that media has moved us into a different direction where now you have cultures feeling comfortable. Is that true, or anybody want to add on that? How have you seen that barrier come down?
I think it's changed. You probably would be better to discuss that, but I know, in the population that I deal with, that I see that it has changed to some degree. I think that a lot of the populations that I deal with are looking for either working with people who are of the same culture still, which does still prevent a barrier. But I also think that a lot of people are looking for that cultural sensitivity so that they know that, certain populations you don't want to look into that person's eyes, or there might be a distance that you need to be away from somebody. They want to know that you are respectful of their culture, and you need to be able to do that in order to develop a trusting relationship so that we can help them. Help themselves.
So understanding the culture barriers of that communication,
Absolutely.
being sensitive and not judgmental. So there are cultures that, it's just not okay to talk about certain things. Like me going up to a man of another culture may not be appropriate. I'm Italian, so there's some things that, boys don't cry and tough it up, and I'm supposed to be in the kitchen, that kind of thing. That's my culture. That's what I grew up with. So we were fighting through those barriers. How have you seen the stigma-free help with that barrier? I know that you want to emphasize on the mental health first aid, because that mental health first aid training really was great.
It speaks to culture, but culture you have to look at very broadly, right? So culture can be the culture of an age group too.
Right.
So young people of a certain culture might be absolutely fine with looking you in the eye,
They'll come hang out with
right?
you.
And then an older adult might feel that it's disrespectful. So one thing about culture is we have to be really careful not to assume, because we can study and we can take cultural competency, cultural sensitivity, cultural humility, but we're not going to know about somebody's culture. So if we're not sure, we can ask. We're giving permission to ask. Ask, because I'm concerned. You really don't seem to be focused on me. I want to help you. Is there something going on that we can't make that contact? And then we get to that question. So again, we have to never assume that we know, no matter how much we study. And we need to have a diverse workforce. That's just really, really important. So we want people who speak different languages. We want people of different culture, always acknowledging that each person experiences their culture different. Right?
I think that's I think that's a really good point, because I can say, working with the Arab American population, that for every commonality I had across my clients, I also found a difference. And so even then, I also have to ask about their own values and beliefs within their family, because it's very different from family to family. But I have to say that with the Stigma-Free Initiative, there has been a lot of wonderful things coming out of it. I know that a lot of Islamic schools now in the city of Clifton, for example, have mental health days or mental health check-ins. And so that's...
And they train the counselors.
And they partner with organizations.
They partner with the organizations. I know that I was up looking on this website, and the school counselors literally have their own page, and they have all the organizations where you can get mental health and mindfulness. I think they still have mindfulness Mondays, where the guidance counselors come on in the morning and they do that, activity. When I grew up as a child, we did not have that.
Absolutely.
Yeah. So when one of our outreaches, one of the students, because we do Key Club and we do high school kids, we have people volunteering. One of the students literally had, said and it voiced it that they had an anxiety on something that they were, and it was like, we're like, really? Like, okay, have a seat. I knew what to do first aid, ask the right questions, brainstorm how to get out of it, and then we put it right back out there. It was like, but that training helped not freak out, go home, send her home, call the mother. It was just relax, take a break, what's really going on, and asking those right questions. Training, stigma-free initiatives, watching videos and learning has helped me understand that. Absolutely. So you're never too old to learn about how you can help your neighbor, help your friend, help your family, and you just take some of those little courses, right? It's kind of, we have to keep living and learning. Life is hard, and it's going to be difficult. It's going to get messy. So when it gets messy, I want to be prepared. So I don't know about you, I deal with a lot of people, different personalities. Maybe some people are sensitive, and I say, I know that's just their personality, their values. So it helps, but you need knowledge. And I think from the initiatives that we've done, knowledge is out there. But now, where do you go? So I know that we have New Jersey Hope and Healing.
And they're not interns, are they? What do I have?
So you have crisis counselors through that program. Yep, and a couple of them are here today.
Yes,
we're so proud that they're here.
Yes, I love them. So when I get hit, when Ida hit, I was already doing, our organization was already doing COVID. So Ida hit, we ended up having, I needed counselors. You need help. You need resources. So I know that's how we met, Ruth. And next thing you know, I've had those crisis counselors on my side since Ida. We ran up 4 flights of stairs with water. We brought food. We also did bedding. And I mean, it was a crisis. It wasn't just a one-time deal. We're talking a 6 months crisis for a senior citizen. So we were trained. We were good. They had help, but we're hitting out that 1-800 number. Like, don't call me, call that number. I don't know how many people called, but it was great to have a resource. It wasn't like just, here, but I said, no, call them up. There's a nice person on the other line. Call them up. So I called them up just to see on a Sunday to see if they really was how that would be. And it was real. It was helpful. So I'm confident giving out those resources. Call. If you can't call, I'll call for you. We'll call together.
Love that.
Yeah, absolutely.
Like with the new 988 crisis suicide line, it's fantastic because as that develops, I look forward to seeing, I just look forward to seeing the results really and how much it helps kind of create that community and bring treatment and bring help and everything to individuals. And the whole idea with that is that when someone calls the line, if they are in crisis, it doesn't go straight to having the police sent to their location.
Right.
The police may not be present whatsoever, only if needed. Otherwise, it's mental health professionals that arrive who
Wow, that's
truly do
wonderful.
understand and can help connect that individual with services in their area.
But we should know it's not active yet.
July
Oh, it's
16th.
July 16th?
July
16th?
16th.
Thank you.
yes.
I was,
So
yes.
July 16th, it will go live, and I believe that it's more than a one-step process. So I think after the number goes out, there's, I think initially they're just doing phone calls, and then they're going to introduce the mobile team to
Yes, I'm sure it'll be
So
a
basically, it's a
process
mobile
to
unit
develop,
that
but
goes out.
Correct.
right. But that is their
The Mental Health Association,
But not
both
immediately.
Passaic and the Mental Health Association in New Jersey has done a ton of advocacy around this, and so that it's fully funded, hopefully in New Jersey. But
Yeah,
the
thank
idea
you.
is it's the call is someone to speak to, right? Someone to come, somewhere to go. So think that gives me chills. Think about that.
Yes.
So
Yeah.
again, we have to see where that goes, and when you roll out something new. There's things that, it's developing, it's exciting,
Right.
it's something new. 911 was first, and now we have 988 that people can remember. I was asking Gada today, I can't remember the Lifeline number, I want to make sure I give it out correctly. So that's not going to supersede the Lifeline yet, so people can still call the Lifeline.
Yes.
Correct.
Because a lot of people really promote those numbers.
Yeah.
And people know those numbers, so
know
they're
them.
they're going to still be
Right.
in operation
Yeah.
for a while longer.
And I think there's something to be said about a mental health professional coming out without the police because, I hear this a lot from my clients, and I don't know if you guys have the same experience, but a lot of times our clients feel almost penalized
immediately.
for,
Yes,
for
feel
being in
penalized,
crisis,
Like, cops are here,
and we have to inform them the cops
Yeah.
will come. Do you
Yeah.
have any dogs at home? Do you have any weapons? And it just takes a very different, sort of a very different scenario than it should for someone who's already in so much stress and is just
Right.
really looking for help. So I think that part of it is really, really good.
Right, and so the police are only called if needed.
If needed.
If needed.
Correct. Where regularly when you call for a screening, the police will automatically come out
Yes.
for the safety of the clinician and the client, but
Right.
in this case, the situation would be assessed.
So you think that that's something that we're learning from coming out of the pandemic? So is that something or something they were working on
I think it's
before?
been on the works for a long
Yeah.
time.
Private
Yeah.
organizations provided that previously, or will still provide it. So say you're a patient at some private pay behavioral health, they will then if you feel in crisis,
Like they'll send somebody.
there's an on-call. It's an on-call, but it's an on-call for everyone, and it's so necessary for.
Right.
I think it's amazing the police don't come too. I think it should almost be a guarantee. I think it's very scary when people are in crisis that when you have that much presence. I worked in an intellectual disability group home for a while, and sometimes when there was crisis, the cops would come and it really escalated. No, the cops always came and it escalated so quickly, and it's just really kind of scary because so we can't expect everyone to know everything, right? So cops can't do all of the things they do and do that, and
Just
I
make
think
sure that everyone's safe.
yeah, it's kind of maybe even unfair to place that kind of expectation on police officers. So to have other people come that are trained is just, I think that's
wonderful
phenomenal.
idea.
Yeah.
And I've seen it work very successfully in another state. I actually worked with a mobile crisis unit with one of the community mental health centers in that state. And the numbers were, I mean, they just spoke for themselves, that not to put anything down on the police like you're saying, but they're not necessarily trained in the minute details that are sometimes involved with a crisis. And so, you know, we would see so many more people not being able to be de-escalated, you know, and when you have a mental health professional come out there and that can talk with them and de-escalate them and, you know, set up a somewhat of a plan for them of what resources are available, the numbers just speak for themselves and how successful it is.
And I think it's only fair to recognize that many people have had negative experiences with the system, and they, you know, people deserve to have that understanding and compassion. We don't want to trigger somebody who's already in a crisis. We don't want to
And escalate it.
Right. So
I just want to speak for a second as I'm listening to the conversation around CIT training, which is fantastic.
say
And
that.
yeah, I'm going to give you kudos because Passaic County does an amazing job
Yeah.
around training police officers as crisis intervention.
I think our entire police force here in Clifton.
Right. So
I
that's
agree.
also
Which
something.
is so important.
Yeah, that the general public needs to know. So if I have a family member in crisis, I can pick up the phone and call the police if I feel like the police need to come, and I can say, hey, this is a mental health crisis. We need you here, but you have a CIT trained officer, and that's really the gold standard, 40 hours of really intensive mental health training. And you can speak more maybe, well, you just got done with the class.
I just got done with the class. It's a wonderful class. It really takes you from beginning to end. You do scenarios and role play, and the cops, I have to say, in the class are fantastic. They're very open to the process, and they're also open to their feelings in general about their own safety, what they think won't work, and so it's a really wonderful conversation. I think just even having the conversation is wonderful. You know, but they're trained, and then they get their little, CIT badges, and they can walk around with them, and so I think it's very helpful. And I have to say, when I used to work with children in home, sometimes we would have to call mobile crisis if the child is out of control. And the times that I did in Passaic County, the cops did really well. And I have to also say, of course, there's always incidents of both, and at the end of the day, though, I think the presence of a cop, as it I think is meant to be, can be very overwhelming for someone in crisis. So the 988 line is also really good.
And also training our police officers is helping us to have healthier communities. That's one of our goals, you know, even at Power of One, is to empower and equip healthier communities. So it's really a collaboration, like you were saying. We all need to work together, not one organization to do it all. There's so many people that need help and assistance, but you need to know who to call, like for the resources.
You're creating these layers of support, right?
Yeah,
All these
layers.
different
I meet
choices
so
that
many
we
wonderful
have.
people, I get excited.
Yeah.
So, and it's always our paths cross, and next thing you know, oh, I have this, you need this, right? We did that today. I have something, she needs this, and it's, oh, we got this. So it's collaborating. It's
collaborating.
I see more of that after the
I
pandemic.
actually, come to think of it now, actually, they just, Rebecca Leone, who's our executive director, was just asked to actually be a teacher at the police academy. So it's kind of starting early with the police
amazing.
force from the police academy before they even graduate to talk about mental health.
And I think it's just wonderful because it helps humanize everyone involved,
Absolutely.
including the police officers. We're all humans. It
Absolutely.
helps humanize us. It's realistic.
Yeah, and that's actually a part of the conversation is we don't just talk about the clients in CIT, but we also talk about the mental health of the cops.
Yeah.
Because
Their
that's
own
a
mental
big-
health.
It all
have their own
matters.
issues as
factor.
well.
Exactly.
It's 1 in 5, right? 1 in 5 adult in
Yes.
any given year experiences some type of mental health or substance use challenge, right? So
Yeah.
it's everybody.
Yeah.
So we can't even put it as they and us, right?
It's
It's
all
our
of
friends,
us.
our families, our communities, our
Absolutely.
coworkers.
It's our people.
And
Just-
it's people, it's being human.
Yeah.
So again,
It's our
you know, in substance use also, we don't want to forget, right? That commonly occurs with mental health challenges. So we want to keep all that in mind. And the more information that we get out, the more we normalize, the
Right.
more conversations are had.
Yep.
And we can be supportive of people in that way, instead of kind of pushing
Right.
them away.
So to wrap things in this direction, where, like if viewers are watching right now, where do they get help today? So there's people that watch this that are sitting on their couches that's suffering right now, and they really don't know which way to go. Maybe they are in counseling, maybe they're not in counseling. But usually most people will call me up even saying, hey Kim, thanks so much for that show, it was so encouraging. I learned so much and I was connected to some resources. So if you, I don't know if anyone wants to add to like, where do you go get help now? The population that you serve, because everyone here is serving a basic population, just, you know, share to someone watching right now, where do they go get help? What's your first step to, you know, pick up the phone and call who?
So we actually, because you know, like we were talking, that with mental health, it's a more big picture issue. And so on our website, mhapassaic.org, under resources, we have a resource guide, and this resource guide is expansive of case management, housing, food, counseling, inpatient, hospitalization.
That's a wonderful list.
And the more we can add to it, we always welcome agencies, we always welcome connections, because the more we can add to our resource guide, it's good because it's comprehensive for our clients. It's a big list, but I do want to say and encourage everyone, when they are given a resource, to contact all of them. We do have, difficulty in getting services out there. I also think, like many fields in the mental health field, we have been affected by personnel, difficulty obtaining
Right.
personnel,
Keeping up with the demand.
and we have an increased demand.
Right.
And so we might call the first place and there's a wait list, and you might call the second place and there's a wait
Right.
list, and you might call the third place and they don't take your insurance. But keep calling.
Yeah,
Keep calling, and I always say, when you call, ask for more resources.
yeah, that's a good idea.
Yep.
Yeah,
If you can't give me the service, do you know where else I can get it from?
wonderful.
And that's I keep going back on the fact that the clinic that I'm here on behalf of is a CCBHC. That is also a big push, is that we are constantly building up that network and our list of resources as well, similar, so that sometimes people contact us just to see what resources we can offer them elsewhere, what we can refer them to.
So someone that needs help, because, you know, I always say that thing about double dipping, so, you know, on funding and stuff like that, so people may feel like, well, I can't get funding from all these different agencies because I'm getting duplicate funding. So one organization cannot handle everybody
Correct.
and all their needs. So you may have a specialty in one area, they're in another area, but that person is going to go to counseling for you, and go to a workshop by you, going to get services from you, and they're going to be in all of this. That's kind of what people think, they just call one and that's it. No, you got to keep on calling, get on everybody's list, and, you know, people will Google up Clifton charity, and I apparently come up. So the first person, you know, they'll call them, leave a message, and they do, they go down the list. I was second, I could pick the phone up. I'm the crazy one who picks the phone up in the randomest time, because I never know who's really on the other end. And if I can, I pick it up, if I don't, they leave a message. And then I'll contact them, and they say, no one really called me back. So I get it. What you're saying is, don't get discouraged, it's just that there's only so many phone calls that someone can really make in a day.
Absolutely.
And if that phone call, and you have a good resource, and people are gonna keep calling and calling. But I know that New Jersey Hope and Healing has that 1-800 number that I keep giving out.
Right. So I
and
like
more
that because somebody
outreaches.
answers it. I know that if I'm a person, if I'm in stress and I'm
I
not
need
feeling
somebody
well, I might try a couple calls. If I have to leave a message a couple times, I might get really discouraged.
Yeah.
Unless I have an advocate or somebody next to me doing it with me, and we don't always have that, right? So we want to make it as easy for people as possible. So yeah, we have the 1-800 number, and that's kind of the clearinghouse of different services. So not just for Hope and Healing, but for the state. We are the designated call line, and I just want to make sure I get it right for the 866-202-4357. That's the mental health cares line. So that's an INR line. You'll speak with social workers. You'll get some assistance. I also want to bring up the peer recovery warm line. I don't know if you have that in Passaic, but the great thing about a peer line is that you're going to call somebody who's struggling with maybe the same thing as you, right? So you're experiencing some of these challenges. You don't want to call anyone because you're scared or culturally it's taboo. You can also call Peer Recovery Warm Line at the Mental Health Association in New Jersey and talk to somebody who is living with a mental health challenge and really working on their own recovery and can help you. Give you some advice, some discussion, some additional resources particular to your situation. So that's a number I kind of want to get out there if I have this opportunity, which is 877-292-5588. So those are really important lines. Every different agency has lots and lots of lines. But when you're struggling, it's kind of hard.
You want somebody on the other end, just to hear you out for a few minutes, give you more some encouragement to keep on calling.
To keep on looking, absolutely.
It's need compassion. They need to hear a soft voice and to help maybe even, shift their mindset into something else for the moment. I know the seniors, they struggle and they're alone, and we have so many shut-ins.
That would be a good kind of idea for the seniors.
We do. That's what we give them.
That?
Oh, yeah.
Peer?
Do they help each other peer?
They call that number. Don't call Kim Castellano.
No, they call each other.
No,
Peer.
Oh, I see.
yeah, that I don't know how they're working
Like a
it.
social-
Oh,
It's
that would be a
just-
great idea.
Yeah, I have no idea how they're doing it. All I know is when they're struggling, we have them call those numbers, and we have the crisis counselors that come with us once a month, and they're sitting at the tables with them, and they kind of know, so they feel comfortable with who they're even calling. So it's kind of like they're relational. But that person on the other phone, on the line, they don't know who that is. They may think that it's, one of our people. That's kind of the barrier breaking that we do. But we're always trying to connect people with resources and help. If I can, if I don't have something right there, I'm calling the next person. Sometimes I'm the one that's calling on their behalf, and they're calling and I'm calling, and then I connect. Because sometimes, we have these relationships. If there's an emergency, I really need help. So you help me and then I advocate, but I don't really advertise that much.
Too late.
Well, it's too late, everybody knows. Kim does advocate. Yes, I do senior advocacy. That's why I'm passionate about the seniors. I did get trained as a home health aide. I did have that. I saw the whole big picture and how the service, how it functions. How do you care for somebody over here? It takes an army. It takes a whole medical
Takes a
field.
village.
It takes a village. Everybody has their thing. There's social workers. There's doctors. There's caseworkers. There's family. Like I said, it gets messy. And then as they age out, they have less and less support. So those seniors, they're dear to my heart, and they say, oh, no one ever comes and visits. So we're there once a month, but they don't get a visitor. So we're always connecting them in the buildings to other resources that can bring in help.
Well, speaking of resources, just to add a little bit more about, since I'm very aware of what we offer at our location, and all the services, like I said, are accessible to folks with private insurance, Medicaid, Medicare, and even individuals that are uninsured, is we offer counseling and mental health to children and adults, but we also offer psychiatry services for individuals 16 and up. And as far as substance use goes, we offer ambulatory detox, which is, you'll start seeing more of it, but it's still fairly new, and that is outpatient detox, specifically for opiates.
Right.
Because other substances may require a higher level of care for safety. But we do offer ambulatory detox, and that is something that for the right person, getting that information out there might be what some people really are looking for.
A lot of people that I get calls for, they want that. And I
Not
don't know
everybody
where to get
wants,
that.
or
Is
not
the
everybody
outpatient?
necessarily needs to go inpatient.
Right, so they're looking for that outpatient, and is that covered by the insurance? Or-
It is.
It
It's one of the services. It's Medicaid, private Medicare,
Right.
people that are
Because some people do want to
uninsured.
go through detox, okay, but they still have their jobs, they still have their.
Exactly.
But yet they want to, they know that they're drinking maybe a little too much, or they're partying a little too much.
Well,
They
it's
just
for
need
opiates,
to-
yeah.
But you said just for the
Yeah,
kids.
yeah, alcohol definitely requires a higher level of care, and that's just for the safety of the individual.
Okay.
But exactly, I mean, it could be in terms of early intervention, or just a relapse, and someone says, oops, and they want to just get back on track. There are options.
Right. So where is Serv actually located?
Serv is right here in Clifton and then located at 777 Bloomfield Ave.
Okay.
And our main number is 973-594-0125. If anyone calls, ask questions, you can also ask for me, Rebecca Quinn. I'd be happy to talk to anybody. We're also accessible by NJ Transit bus 709, stops right outside of it, which is convenient.
Excellent.
Yeah, and it is great, and I'm happy that I can speak on behalf of the clinic I work, but there are other clinics like ours, as there should be, and there's more and more of them, as there should be, and there's a lot of different services that are offered, like an on-site pharmacist. How convenient. You get all your meds filled there. We have a very diverse clinical team, and we're even able to see people, kind of treat some physical health needs, basic health needs. We have our nurses. So we welcome people even with complex health needs, things like that. And there's more places like this popping up. So it gives me faith.
Yeah.
Yeah.
That's great.
I mean, there's the other services like medication to support recovery, which is a new progressive way of saying MAT, medication-assisted treatment. It's medication to support recovery.
Okay.
There may be medications that can help you if you are struggling with a substance use disorder or, for your mental health.
Okay.
And groups that we offer, things like that.
Right, everybody here has pretty much group services during the week, right? Yeah. There's a schedule, you go on the website,
Yeah.
you can just jump into it.
And it's great because all our different organizations, everything that we offer, it's all valuable and it's all nuanced too. So the groups that we do may not be the best suited group for someone calling. And I would assume none of us are to have too much pride. If someone calls, well, we may not be able to help you. However, I know Beth, or I know, Gata.
We have a
and-
group on this day and that
Exactly,
day.
and that may be of more interest to you. So.
And the virtual groups are just
Yeah, the virtual.
incredible.
They're-
Yeah.
People who've
There's-
never had access,
Nope.
due to
Yeah.
transportation, childcare, stigma.
Well, how do you see those groups are still populated?
They're
still-
populated, yeah. But, we're going back in person as
Right.
much as we can, but there's a place for those groups.
So,
Wonderful.
yeah, in mental health care,
Yeah.
transportation and access was always a gigantic barrier, and it still is in so many places.
Right.
And I think in like metropolitan areas, more urban areas, like where we live, things are maybe easily accessible. There's public transportation and different ways to access. But as a country, that's always been a huge barrier, and I think we're realizing
telemedicine.
still what a barrier it was. Even
So hopefully
here.
they'll be
Yeah.
And there's
keeping-
tracks, and I know that you have them also, but we have 60 plus groups a week.
Wow.
In a subscription service we have for United by Wellness. It's at no cost. And
Wow.
people can pick an employment track if they're experiencing challenges around employment. So it's just it's getting the word out there.
Yeah.
That's hard. And then helping people get the technology.
Yes.
And helping
Yeah,
people who
too,
like,
yes.
is my camera on?
Yeah.
So how have you seen the seniors dabbling into the?
It's a challenge. It's
challenge.
definitely a challenge. I think that I'm seeing a lot of family members who would not normally be around are
Yeah, are
actually
around that
helping
day.
because they see that there's such a problem, so they'll help. I see home health aides and home health in general playing a huge part in that because we see that a lot of the home health aides will help do either a FaceTime call
Yeah.
or virtual groups or virtual therapy. So it does involve though helping because that technology is just not there. But they're starting to get a little bit more comfortable with it.
Yeah, I see like a lot of our seniors, they do have iPhones. I mean, it all depends on what age group that is, but I see that they have, their cell phones. Whether they know how to use that, I don't know. So anyway, for the sake of time, this was wonderful, ladies. We did it. We rocked this thing. I just really appreciate all of you being here. We've never done on Conversations That Inspires a round table like this. I think we should maybe be able to do some more like this because it's valuable information and it's from all different agencies and backgrounds and showing the world that we really do need to work together. We do need to work and collaborate together. So I really want to just encourage you to, like all of us, to stay connected. We do have that network resource fair that we do twice a year. It's free to the agencies that are in the network. So we're forming this network here in Clifton. It's the Resource Expo. And I invite you, caring people, to come. I know all of you have been a part of it, right? PAC has been there, and so has the Mental Health Association, both. You guys always sit next to each other. Those two organizations. I'm going to separate you next time we have an expo. I look forward to, this is the end of summer. We're going to enjoy summer. And I know that you see this art. I really would like to launch a new, under our stress coaching groups. I love in-person. I'm an in-person person. I stunk when it came to online. I did it, but didn't like it. So there are people who are happy coming out, but activities is something to help the mental health, whether it's crocheting, knitting, painting, doing. We're going to bring this creativity into our seniors. Our senior population are so underserved. That's why I'm so happy to get the paints out, and they're doing it now. They're coloring, and they just don't have the resources. We have to bring it to them. Yeah. I can't tell you how many pencils I gave away because they don't even have pencils. Yeah. So it's a sad thing, but it's a great thing that, we're all talking about it. Yeah. And no one ever cared about arts and craft before.
I've always cared about arts and crafts.
Who did the paint and sips in your houses, right? Yeah. That's where all that stuff came from. Like, we ordered that.
Oh, we did. Right.
We did. We had so much fun. Yeah. We had a paint night just with the family, and it
just
was the ladies.
Just it was real therapy. Fun. It was great therapy. We said we got to do this
sense
again.
of community.
Yeah.
It's a sense.
So thank you, ladies. Thank you, everyone, for watching.
You.
And now, just to wrap things up, does anyone from the audience have any questions to add to that packed house of conversation? Did you enjoy that? How was it watching?
I have a question.
Oh, no. Okay, you have a question.
Does New Jersey have a line like 211?
Yes.
That is a resource for everything under the sun.
Correct.
It's a partnership with the state and United Way.
Yes.
Yes.
What is
so
it?
I went to, it's 211. If you, anybody, any kind of crisis that you're in, whether it's homeless, you need food, domestic, electricity, basic needs, you dial 211 and you have to open a claim. So there is a process. You open the claim, and then they will send you referrals. So they'll send you to Catholic Charities, they'll send you to United Way, and then, again, you're calling in the list and you're getting it, but you have a referral. I know this because of Ida, that everybody had to. We worked very close with Catholic Charities. So they came alongside of us and they had resources. The state came along and said, use this and do this, and we took care of Clifton that way. So they had to go to 211 first and register. Once they all registered, then we did that. So, yes, good questions.
Thank you.
Okay. So that's it.
Thanks for having me.
Thank you for doing it.
Thank you so much. Awesome. Everybody did awesome. So thank you so much for watching another episode of Conversations That Inspire with your host, Kim Castellano.
Excellent.
Woo, we did it.